Good afternoon, everyone. This is Sandra Arevalo from Montefiore Nyack Hospital in Community Chats. And today we're going to be talking about advanced decisions for your healthcare, which has to do with legal issues as well as personal issues. And it can be a sensitive topic, especially towards the end of life or when you are in the middle of an accident and you cannot make decisions by yourself. Sometimes it's hard to designate someone to do it. And then if you're on the other side and you are the person who might need to make those decisions, you need to know some rules and regulations about that as well. We all want to be prepared because, God forbid, we go through this situation either as a patient or as a family member. We all want to know what the wishes of the people are, right? Our family members. And we want to make sure that those wishes are fulfilled. And also, it gives us peace of mind. But I'm not the expert. We have experts, as we do every Thursday. So today, our experts are, well, I'm going to let them tell you yourself. So let's start. Kitty, do you wanna start since you're up on my screen?
Okay, so hello everyone. My name is Katie Howell. I'm a nurse practitioner here at Montefiore Nyack Hospital on the palliative care service.
Okay, thank you very much. And how long have you been working here?
So I've been at Montefiore Nyack Hospital for over 6 years, and I believe I've been in the palliative care service for approximately 4, but starting as a registered nurse and working as a nurse practitioner in the role for about 2 years now.
Oh my God, I can't believe how long it's been, 2 years. Okay. Thank you for being here. Dr. Shapiro, please introduce yourself.
Hi, my name is Tara Shapiro. I'm a palliative care physician. I've been with Montefiore Nyack for about 1.5 years now. And previous to that, I worked at Montefiore Weiler and Moses Hospital down in the Bronx for 3 years. And then prior to that, I was an emergency medicine physician for 26 years.
Mm-hmm. And you just mentioned something. You said you are a palliative care physician. So can we start right there and just quickly describe what palliative care is for our attendees who might not know?
Sure. So palliative care is a big umbrella of care. And we care for patients and families who have serious illness, and we treat the symptoms that come from it, things like pain or difficulty breathing. We try to make life better, whatever quality of life we can make better. And then we also talk about difficult decision-making surrounding healthcare. Very often people equate palliative care with end of life, when in fact we are able to treat many patients throughout their disease courses. Some patients have curable diseases. The end of life or hospice care does come underneath the umbrella of palliative care, but it's really reserved for just those last 6 months of life. So if you ever talk to a palliative care doctor, it doesn't mean that you're dying. It just means that you need some help with improving the quality of your life.
Oh, well, thank you so much for making that distinction. I feel that a lot of us, think palliative care is end of life. So, okay, that's very good to know. Palliative care is not hospice. That's very good. I think we should always know that because, yes, we get scared every time that we say palliative care. It's like, okay, there is nothing else you can do for me. So thank you for clarifying. Now, let's get into the topic then. And we are here to talk about advanced care planning. So what is that really about?
So advanced care planning really involves conversations about your future health care plans. And it does involve creating legal documents, sometimes advanced directives, and it really formalizes your decisions. And again, just like we don't want you to be scared of talking about end of life things, we also don't want you to be scared about talking about these things. We like to talk about your plans well before a situation or an emergency happens. so that we're not making an emotional decision in a moment. Many people who decide to buy a car or build a house or do a renovation of a kitchen or things like that, we plan for those things well in advance of having them done. And so this is the same thing. We want to plan ahead of time, talk about values and what's important to you, and then legalize them in documents.
So a quick question. We're going to talk about legal documents now. Does that mean that we need to have a lawyer involved, or is that something we can do with you?
So there's different types of advanced care planning documents. A living will, which many people are familiar with, that's where the individual, states their treatment preferences. But like Dr. Shapiro said, this is after thoughtful consideration ahead of time. A living will is generally completed with an attorney and notarized by a notary, and it is considered a legal document. A healthcare proxy is another example of an advance directive, but that one doesn't need to be notarized. It can be witnessed by two adult individuals that are not designated as the healthcare agent. Other examples of advance directives would be like an out-of-hospital DNR. That is generally completed with a physician, but all of these documents should be, are considered legal documents and followed.
Katie, can you explain DNR?
So a DNR is an acronym for a do not resuscitate. So if an individual doesn't have a pulse or is not breathing and they have a do not resuscitate in place, it means that resuscitation would not be attempted. So chest compressions or, other forms of resuscitation.
So CPR, no CPR. It's like, leave me alone.
No CPR, that's right.
Okay, let me die in peace. Okay, don't break my spine.
So, Sandra, if I could comment on that a little bit further, it doesn't mean that people don't receive other treatments. Many times we encounter families and patients saying, well, I don't want to be DNR because then you'll just leave me alone in the corner, which in fact is very untrue. You are entitled to all treatments. It's just if your heart stops and you're dead, we're not going to do that.
That's very thoughtful. Thank you for clarifying. Okay, so for example, if I'm sick, they're going to give me all the treatments. It's not until my heart is going to stop, like I'm basically dying, literally, that the DNR, do not resuscitate, comes into effect. That's very good.
Yeah, and I think that's an important clarifying point because we do encounter that misconception here in the hospital a lot, that individuals feel that a DNR would influence the level of care that they're receiving. So that's education that we often provide to them, that it doesn't influence the care and you will be treated, up to and including all treatment necessary until your heart stops.
Yeah. Wow, that's very important to know. Now let's go back to we know DNR now. Let's go back to the living will. What should be in a living will? What type of information?
Yeah, so a living will contains a lot of information, and it's done with a lawyer, not with a healthcare provider at all. And it delineates terms of what you want. And it could be, you could actually write in things yourself, wording of things such as, I wouldn't want CPR if my heart stopped, or I would want a feeding tube if I couldn't swallow safely on my own. I would want dialysis, or I wouldn't want dialysis if my kidneys failed. If I got very sick with pneumonia, I would want a ventilator, but I wouldn't want a tracheotomy long-term involving staying in a nursing home. So a lot of this information is can be complex. Sometimes it's difficult to understand which ones that you would want. And a lawyer typically will have wording that may be rather loose in nature, meaning if I have an irreversible condition, I can't cognitively, or my brain can't think normally, I wouldn't want aggressive means of resuscitation. And so these documents, because they're done with a lawyer, and not a healthcare professional, they are not medical legally binding, but they do give us a great framework of what a person's thought process is, what their values are. And it reminds me that we should have continued conversation with our loved ones, and especially the person that you would choose as your healthcare proxy, so that they understood the specifics of what an irreversible condition is to that person, and what things they value in life that make life worth living for them, because that's a very individual decision. So a lot of these documents are written very loosely and not specific to a person, but they can be done specifically if the person has that knowledge to say, you know, what if they had a relative that had a very bad disease and they felt that they wouldn't want to go through a specific treatment, they could write that down. But in general, if you just go to a lawyer, they're going to write down general things that are still going to require further conversation at the time of illness.
You got me thinking about a couple of things, Dr. Shapiro. When you say it's not medically, legally binding, can you elaborate on that?
Sure. So, for instance, if this document was presented to us and it had very loose wording that said, I wouldn't want aggressive means of resuscitation and life prolonging if I had an irreversible disease process. But the family felt otherwise and thought that they would want a procedure or a ventilator to be kept on for a period of time to give them a chance. We would still provide that care despite it being written in that fashion, because the family knows the individual in a specific incidence. And because the documents are not filled out with a healthcare provider that can provide those specific questions and interactions, that's where the medical legalness of it is not completely binding. But it gives us a great framework and a good understanding of this person did think about why they wanted things or didn't want things. And now we have to have further discussion with that patient and the family.
If I'm not in the healthcare field, you know, and I don't know what CPR means, I don't know about tube fittings and all of these things that can suddenly happen even after an accident, even a blood transfusion, right? Even something so simple to us as a blood transfusion. How do I know what to put in a testament? And are there any specific lawyers that deal with that are going to know about this? Because otherwise, you know, as a consumer, as a patient, it's going to be very hard for me to write something down in a will when I don't even know it exists. So
yeah, that is a huge challenge. Some, just like some doctors and nurses are really good and some are not so good. Yeah. Some lawyers are really good about teasing out the specifics and going that extra mile. I think the more a person educates themselves on the potentials of what their disease processes that they already have might be in the future, asking their primary care physician, like, hey, I have diabetes. What are the things that as I get older might happen to me that I have to think about whether I would want those things done to me or not, and what treatments I may or may not need. Having honest conversations about those things. I think that helps a lot. And then having that thoughtful conversation, especially with your healthcare proxy, about I like to call it the what ifs. What if I got a bad pneumonia? What if I had an amputation? What if I had a spinal cord injury? What would life look like? this is what I want, this is what I don't want, having those honest conversations, and then including that within your living will, which is something that you can request.
Mm-hmm. At what age can you write a living will or have a living will?
Yeah. That's a good question. I think it's the legal age of adulthood, which in New York is 18. But there are people get legalized as an adult earlier for various reasons, such as the military, being a parent. They can be an emancipated minor. And so in those instances, they can make advance directives. There is also a trend, even in the pediatric world, that when a person becomes of an age of capacity where they have the thought process and the understanding, maturity wise, to be able to understand their disease process, they can make their own decisions. And it is state by state legally.
Mm-hmm. Yeah, because I think you hit the nail in the head here, because there might be kids with cancer, for example, who are tired of treatments, and the parents keep seeking treatments and bringing them to the hospital, and they get to the point that they say, I don't want to do this anymore. So that's what got me thinking about this, at what age.
There are legal cases that have been brought to the courts over the years, many, many years, starting in, I think, the 1960s even, about minors being able to make their own decisions. And they may have to go to court, or if you have a good palliative care doctor to help guide you through that difficult decision-making process, it's very, very helpful.
Yeah, actually, you just reminded me there is a very good movie about this. I don't know if you guys have seen it, or some of our attendees. My Sister's Keeper. It's beautiful.
Mm-hmm.
Oh, you've seen it? Yeah, it's like that, right? It's like this girl with cancer. She doesn't want to continue with treatment. She has to go to court. Anyway, it's a beautiful movie, very beautiful movie.
Mm-hmm.
Are there any questions that we can ask ourselves, or that maybe can help us start making decisions towards this living will? Something that you suggest we can start thinking about?
There's many tools even on the internet, like the 5 wishes is a really good way of documenting what's important to me, what makes life great. Just even asking yourself simple questions like, what is a good day for me? When was the last time I really enjoyed something? Or what are the things that are so vital to me that without them, life wouldn't be worth living if I couldn't do X, Y, or Z? And, really understanding, like, you as a person, what are you willing to tolerate as far as treatment or disabilities? Because as we get older, we can't do the same things we could when we were 20. And we all adapt to that to some degree. And everyone's an individual. So some people, for them, they just can't. And so what are the things that you're willing to give up in order to get more time that still involves quality of life?
Mm-hmm. And when we need to choose a healthcare proxy, I think that's a difficult decision as well. For sure, I wouldn't invite my worst enemy to be my healthcare proxy, right? It's like, okay, cut all the limbs now and leave her like that now. So how can we choose a good healthcare proxy? Because I might also love my husband or my mother very much, but they might not have the guts to do what I want to do. I don't know. These are very thoughtful. This is a very thoughtful topic.
Yeah, I mean, I think one of, so to define what a healthcare proxy is, a healthcare proxy is somebody that you designate to make decisions for you if you've lost the ability to make decisions for yourself. Sometimes that loss of ability or loss of capacity is temporary, in which case they would serve, temporarily and advocate for your wishes. And then, if your condition resolves, you can make your own decisions again. And sometimes they're making decisions for you in an ongoing basis. So a healthcare agent or proxy, is someone that you should trust. Some people pick their family or close friends, but it needs to be somebody that you feel will serve as an advocate for what your wishes are. And you can choose a primary healthcare proxy, and you can also choose someone as an alternate if that proxy is not available for some reason. And like Dr. Shapiro said, just like when you're doing an advanced care planning conversation or drafting a living will, picking a healthcare proxy requires careful consideration too, and so do the conversations with the healthcare proxy. You don't have to write your wishes on the healthcare proxy form, but there is the ability to write them if you want to. But the idea is that you have taken time to have these difficult conversations with your healthcare proxy, so they have a sense of what your wishes would be in those what if situations. I always say to patients that a healthcare proxy is generally making decisions for you in a very serious moment, and it's a big responsibility for them. So there should have been some conversation with them beforehand about, what your values are, what's important to you, what you consider to be an acceptable quality of life.
Mm-hmm. Mm-hmm.
And Sandra, if I could just elaborate a little further on what Katie said, some healthcare proxies have had some conversation, maybe not very in-depth conversation. Some of these people get very overwhelmed with a feeling of responsibility, where in fact I explain to them, you have no responsibility. The only real responsibility you have is being an interpreter, is telling us what your loved one would have said had they been able to understand everything. What would they say to you? Be our interpreter, because that burden of decision making really is not about the healthcare proxy. It's really about that conversation that should have already occurred and the interpretation of what that person values.
Yeah, I love to think it that way. Thank you for that. Like it's an interpreter. I'm really there just not to make any decisions. The decisions have been made by the person I'm protecting. I just need to make sure that I voice those wishes, but I'm not making any wishes for anyone. Okay.
Right. And then,
Yeah,
ask
I'm weight off my shoulders.
Yeah, ask the healthcare proxy, when you're having those conversations, is this a role that you would be comfortable with? Do you feel that you would be comfortable advocating for me and my wishes, even if you maybe don't necessarily agree with them,
Mm-hmm.
right? Because their role really is an advocate, and it's really a safety, measure put in place for the patient to make sure that their wishes are going to be respected and valued. So those are questions you should ask your healthcare proxy as well.
Now, let me ask you something else. I don't know if it's a cultural thing. Maybe you guys have the answer to this, but sometimes when you want to start having that conversation with your family, with your loved ones, people shut it immediately. Like people don't like talking about death. They don't like talking about somebody else's death, even less our own. So when you kind of start mentioning, in case something happens to me, then people are like, oh, nothing is going to happen to you. Oh, let's not start that. Oh, we're not going to talk about that. So how do you, and that's the part that I don't know if it's cultural, but how do you engage your family, your loved ones, those people that you want as proxies? How do you engage them in that conversation so that you don't get shut up and be like, let's switch topics. She started already. Oh my gosh, a fatalist, right? So how do you do that?
Yeah, I mean, I think in circumstances where it's, maybe a child wanting to, inquire with their parents, say, for example, and get a sense of what their parents' wishes are, I think it's important for them to do their own personal reflection first, understand kind of what they would want in certain circumstances. I think it's important always to have these conversations during a time that is calm and not a chaotic time when people are sick and you're trying to make decisions quickly. A lot of times too, if you want to engage a conversation, it's helpful when you relate it to something maybe that's been a mutual experience between the two parties. Maybe it's been the illness of a loved one. Maybe it's been an accident you saw in the news. Something that you both can sort of relate to, but not in maybe a direct way, and use that as an opportunity to start that conversation. If I was this individual in this situation, I wonder what I would want.
Go ahead, Dr. Shapiro.
Yeah, those are great ideas. A lot of times it could be a book, a movie, the previous death of your grandparents or your parents, and relating those conversations. And the other point that I really wanted to drive home as well about healthcare proxies is that if you put this decision to assign or ask a person to be your healthcare proxy, if you put that off and never end up signing a paper, and you end up becoming unable to make your own decisions, every state has a law in place called a healthcare surrogacy law. So a person would be in a sort of a hierarchy for each state, be assigned as your surrogate decision maker. And so for New York State, that would start with a spouse, then go to adult children, then your parents, then your siblings or extended family. And if you have none of those, then it can go to a close friend or a religious figure. And so people should understand that if they're in certain situations, there are people who are in very unhealthy relationships. And if you're still legally married, that spouse has the right to make decisions for you if you become uncapable. And so I really urge people to choose a healthcare proxy. You don't need a lawyer. You can print the paper out on your own home computer and have two people witness it, as Katie said, who are not named as the healthcare proxy. And it is a legal document. And so I really encourage people to do that sooner than later. And those can always be changed too, right? Later on in life, if you name two friends and then you're no longer friends with them, you can change that document. That's okay.
Okay. Now,
Yeah, Dr. Shapiro and I, we always encourage really every patient in the hospital to complete a healthcare proxy. And anyone really above the age of 18 can complete a healthcare proxy. And it's something that's really, easy to institute. Like Dr. Shapiro said, you only need two adult witnesses, and you can actually get the form right on the New York State Department of Health website. So I can put the link in the chat if anybody's interested.
That'd be great. Because I was just going to ask about that, like, where do we get the form? Because you keep saying the form. So where do you get the form? But also, where is that form going to lead?
So I always encourage people to keep a copy for themselves, to give a copy to their healthcare proxy, and to also upload it onto like a Google Drive, right? We all have access to phones, and hopefully most people are savvy enough to be able to have it on Google Drive, so that if you are somewhere and you get in an accident, you're hospitalized, you could access it and be able to give it to the healthcare providers. You can also take it and if you do have a lawyer, you can say, I've already filled this out, here's my document, and give it to them. And giving it to your primary care physician as well to make sure that it's in the medical record is very, very important as well. And I also wanted to point out in New York State, now each state has separate laws, but in New York State, domestic partnership is recognized equal to a spouse. And so they don't strictly define domestic partnership in New York State. And so really anyone that you're living with could end up being your surrogate decision maker if you don't have this healthcare proxy. And that may be a person that you trust or you don't trust that much with these important decisions. And so we should think about that.
Mhm. And I have someone in the audience who's asking exactly what I wanted to know. So this is handy. If someone has an accident in another state, let's say, then how are you gonna know? Let's say, okay, I'm on vacation in Florida, I'm not with my proxy, I'm unconscious. They can't ask me who my proxy is, where my living will is. I'm not gonna carry a copy of a form in my wallet, I guess. So then what happened?
I think, when these things happen, these sort of like tragic events far from home, I would anticipate that the facility receiving the individual would do their due diligence, try to contact family, maybe, obtain records from another facility and, a hospital located closer to that individual's home. And a lot of times, there's a way to find those documents that way. Not always, unfortunately, but I think, with the assistance of social workers and the team caring for the patient, I think that we all do our best to try to make sure if those documents exist that we find them.
Mhm.
So you will receive full care. There will be no care that is denied of you.
Right,
So
of
they
course.
will do extensive means to prolong your life. If you need a breathing tube, a ventilator, you will get that. If your heart stops, you will get CPR. You will get full treatment if nobody knows who you are or who your family is. Um, so the other really good thing, my experience in the ER led me to this. On our phones, there's the in case of emergency page, and that can be accessed without accessing your phone. And that gives healthcare providers an idea of you could load anything you want to in there, all of your medical problems, your medications that you take, and you could list your healthcare proxy in there as well. And so it was very helpful for a patient that we had in the emergency room who was unconscious, and they had no ID on them, but they had their phone on them, and so we were able to figure out who they were based upon that. So it's often very, very helpful. There are patients that don't want blood transfusions, and they can put that in there as well. And so I think that's another good resource beyond giving it to your primary care physician and your family members as well.
I love that. The in case of emergency thing on my phone. How do I access that? Now I'm looking at my phone right now. So how do we do it? Because more people here are asking, like, what? What is this? Show me.
Yeah, so each phone is different. The iPhone is different than the Android. I have an Android, so I may not be able to answer for everyone. But if you can Google like how to get into it. But for the Android, you press emergency in case of emergency on the lock screen, and then you can come up with the emergency contact numbers that I've put several family members in there. And then in the bottom left corner, there's medical information, and you press on that, and you can fill out all of those things as well. So just Google it because that's what we all do to figure a lot of things out. But
I
the
will.
iPhone is different, and I'm not familiar with it.
Yeah, no, that's very helpful. I'm looking here. I don't even know how to find it. I put ICE and it says ice cream. I don't think that's what I want. Well, yes, I do want ice cream, but that's not what I'm looking for. Okay. Someone is saying here, yes, you can find it in the contacts in my profile. Very good. I will try later. Thank you so much. Is there anything else that you guys recommend for us to be prepared before we leave? And if there are any questions from our attendees, please start writing them down. Anything else that you would like to tell us before we close for today?
No, just really that I think, it's healthy to try to normalize these conversations a little bit. I understand that they can be sort of a frightening topic, and we want to pretend that it doesn't exist. But I think one of the healthiest things is to actually start these conversations early on. It becomes easier for the patient and will hopefully prevent unnecessary pain and suffering for them. And it will also be easier for the family or the healthcare proxy when they are in a position to make decisions for them. So difficult to engage the discussion, but over time, it becomes more normal, and it's just a very healthy process. So we try to encourage that.
Yeah. No, definitely. That's again, it's not the most cheerful conversation to have when you're in a dinner, but definitely helpful and something to think about. Yes. Dr. Shapiro.
Yeah, Katie said it so nicely. Normalize the conversation. We all have to die. Nobody can escape that. And we should all be able to have choices to die on our own terms and with the respect that we want. That includes, anyone's choice to have full care or to have no care. And so I really think that those conversations are so important. If there's people out there in the community who have loved ones who have chronic illnesses and are starting to get debilitated, I would encourage you to look up a thing called dignity therapy. There are a list of about 9 or 10 questions that go through really important and very insightful things for people to think about. I almost think like all of us should do that every 6 months or a year to reevaluate who we are in the world and what message we're putting out there.
Yeah.
And, they're precious memories to keep. There are some companies that will charge you money to videotape these things, but we all have a cell phone that we could just do it on our own.
Mm-hmm. Yeah, and maybe one good opportunity also is when you get diagnosed with a chronic disease or any disease, right? Like, especially if you know that it's a debilitating disease, you might like to plan ahead, definitely. Okay, there you go. So that was our topic of the day. We are all ready now to write our living will, look for the proxy form, put the eyes contact on our phone. So lots and lots of good tools here to get prepared for when hopefully never happens and we don't need to use these. Yes, I agree with you, Dr. Shapiro. Of course, we all have to die, but hopefully we all die in our sleep and we don't have to worry about this. We'll see. Okay, thank you so much to our attendees and for your questions. And of course, to our experts, Katie Howell, Dr. Shapiro, Dr. Tara Shapiro, thank you so much for being here. Good conversation to have with you. And our attendees are also saying thank you in the chat. So I will see you next week. We're going to be talking about pranic healing. If you don't know what that is, me neither. So we're going to learn together, but it's some sort of Eastern energy healing. So it will put us in a good, relaxing mood. Yes, hopefully. So thank you so much, everyone, and see you next week. Bye-bye.
Thank you.
Thank you very much.